Alright, Bryce, we're going to be palpating some structures on your anterior hip here. So would you mind moving your shorts down slightly? So here we can find the ASIS. This is the origin of the sartorius. It's also helpful in finding the AIIS. If you just move inferior and medial to that, you should get a bony infill. And the greater trochanter is going to be on the side of his upper thigh right here. You can feel the bone in there. And that is the point of insertion for the external rotators as well as the gluteus medius and minimus. And to palpate the femoral triangle, we're going to have you place this foot on the knee. And then like that. Would you mind pulling your shorts up slightly? And then go ahead and resist against my hand, and we can feel the adductor longus in here on the medial side, and then on the lateral side we have the sartorius. Superiorly we will have the inguinal ligament, and then in the triangle we also have the pectineus as the floor, and we'll have the femoral artery and nerve as well. So to palpate the liver, I'm going to come in on the ribs right down here and going to have you take a deep breath, and I can feel the liver as it pushes against my fingers there. This will be important to palpate because we can rule out any sort of liver abnormalities in the patient. Okay, so to palpate the talus, I'm gonna have you plantar flex, and then I'm gonna come down off of the anterior tibia, and then once we get off that, we know we're on the dome of the talus. We can also palpate this on the side here in the sinus tarsi. We can find, here is the neck of the talus. The talus is important because it is the bears weight from the leg. It's also helpful in finding other bones in the foot, such as the navicular bone on the medial side, which we will go to now. So here is the navicular bone. We can feel this bony prominence here. That is the navicular tuberosity. This is the site of insertion for the tibialis posterior. Also, it has attachments for the spring ligament. The anterior talofibular ligament runs from the lateral malleolus to the neck of the talus. So if we have implantar flex and then invert, we can feel the ligaments in there. This ligament is the most commonly sprained or injured in an ankle sprain. So the base of the fifth metatarsal can go on the lateral side of the foot here until we hit a bony prominence right there. So this is the site of insertion for the fibularis brevis and tertius. It's also helpful in finding the cuboid bone. If we just roll off proximally, then we know we're on the cuboid bone. All right, let's have you in a seated position now. So here we can palpate the joint space of the knee. If we just roll off the end of the femur right there, just above the tibial plateau. This is important because we can go medially until it forces us out. That's how we know we hit the MCL. We can also have him internally rotate his lower leg, and then we can feel the meniscus in there as well. The fibular head is on the side of his lower leg right here. This is important because it has attachments for the lateral collateral ligament of the knee. It's also helpful in finding the superficial fibular nerve just inferior to that. So for the 12th rib, I'm going to come down here in his lower back. We can feel his ribs there, another rib, and then here's the 12th rib. This rib is a floating rib, and if we would follow it all the way back to his spine, we would end up on T12. The first rib, we're gonna come up here to his neck and just go down on the side until we hit the bony end feel right there. That's how we know we're on the first rib. This is the insertion point for the anterior and middle scalenes. So we can have him do a forceful inspiration, and then we can feel those muscles contract in there. To find the C2 spinous process, we're going to come back off of the occipital bone into his neck until we get the first bony end feel in there. That's how we know we're on the C2 spinous process. This is helpful in finding or locating other cervical vertebrae. Also, it is a point of muscle insertion or origin for the trapezius. C6 and C7, so can you go ahead and flex your neck? So we can see the most prominent vertebra right there is likely C7. So go up just one, we're on C6. Go ahead and extend your neck and then flex it, and we can feel that poke back out. This is helpful in locating other vertebrae, as well as it also serves as a point of muscle attachment. The articular pillars we can find on the lateral side of the neck. So you can push in, we have a bony end feel, but we are palpating through the paraspinous musculature. So we can't get a lot of detail, but this is typically fairly tender on some people. It's also where the facet joints of the vertebrae articulate with one another. So the acromioclavicular joint, we can follow the clavicle until we hit this prominence right here. This is the acromioclavicular joint. So this is where the acromioclavicular ligament connects the clavicle to the acromion process. It's also the joint that is separated in a shoulder separation. The spine of the scapula we can feel back here, and this is helpful for finding the supraspinatus above and the infraspinatus below that. It's also a point of, it has muscle attachments for the trapezius and the deltoid. And then for the inferior angle of the scapula, can you bring your arm behind you and then like that? So here we can see, we can feel the inferior angle of the scapula. And this is helpful if we draw a line directly to his spine. It'll bring us to about T7. It also serves as a point of muscle insertion for the latissimus dorsi, as well as the origin for the teres major. The coracoid process is up here at anterior shoulder. It's just inferior to the clavicle here. So if we push in, we should feel a bony end feel right there. And we know that this is the insertion for the pec minor, as well as the origin for the coracobrachialis. And then, so the greater tubercle of humerus is right here on the humerus. It's a prominent bony structure. This is the site of insertion for the rotator cuff muscles. It's also helpful finding the intertubercular groove. If we just go anterior to that, then we have groove where the tendon of the long head of the biceps lays. The subacromial space, so we find the acromion process here. If we just roll off of that, we're in the subacromial space, and we know that this has the tendon of the supraspinatus muscle as well as the tendon of the long head of the biceps brachii. So the lateral epicondyle, we can feel it here on the lateral side of his arm. This is the insertion point for the extensors of the forearm. It also has the origin of the supinator muscle. And on the medial side here, we have the medial epicondyle. We can feel there, it's really prominent. This is the common origin for the flexors of the forearm. It's also helpful in finding the ulnar nerve. So if we were to just roll posterior to the medial epicondyle, we're in this little groove where the ulnar nerve sits. The radial head can be found on the lateral side of the forearm. So if we push in here at the elbow, we can feel the head. And if you go ahead and pronate and supinate your arm, we can feel that spin in there. So that allows for that movement. It also sits in the annular ligament, which holds it in place and allows it to spin. Down here, can you extend your thumb like that? So in this little snuff box right here, we have the scaphoid bone. This is a commonly fractured bone in a fall on an outstretched hand. Also, overlying this bone, we can feel the radial pulse. And then the triquetral bone, we find the ulnar styloid process right there, and just roll distal to that. We are on the triquetral bone. This bone makes up the medial side of the carpal tunnel, and it also has attachments for the ulnar collateral ligament of the wrist. So can you go prone now?
Yeah.
So I'm going to be palpating structures in your lower back and pelvis. So is that okay?
Mm-hmm.
Would you mind moving your shorts down a bit? So if you come up here, the first bony prominence we feel, that is L5. This is a common site of pain in patients, and the spinous process also serves as a point of muscle attachment. So the PSIS, we go in back here, and we can feel the PSIS right there. This is helpful in finding the sacroiliac joint. If we just roll medial to that, then we're over the joint. It also has attachments for the sacroiliac ligament. The inferior lateral angle of the sacrum is right here. And this is important because it is the origin site of the piriformis muscle. It also has attachments for the sacrospinous and sacrotuberous ligaments. And then finally, we have the ischial tuberosity. We come in up like that. We can feel the ischial tuberosity on my thumb. This is the sitting bone, so that's what we sit on. And it's the common origin for the hamstring muscles.